if you have vertigo, Meniere's disease, mdds, or any other vestibular disorder, this area right here is the most common cause of these conditions. It's not the cause of all of them, but if you've been to the vestibular physical therapist, you've taken meclizine, antivert, and you've done all the mainstream things and you're still suffering with these things and you haven't had any relief, the atlas, which is this vertebra right here, it fits to the bottom of the skull, and inside of it is a structure called the brainstem, and inside the brainstem sits what's called the vestibular nucleus. This is the control center that coordinates sensory information from the eyes, sensory information from the inner ears, and the one that almost nobody considers is sensory information from the joints of the atlas. What can happen is when the vertebra locks out of position from a prior trauma and it doesn't move the way it should, these nerve endings on the joint surface send feedback into the vestibular nucleus, and it can cause an interruption to the vestibular system. So if you're someone who tilts your head back and gets dizzy, or turns your head to the side and gets dizzy, that's a very clear sign that's most likely coming from the neck. And if you don't get that type of dizziness with head movement, you still should be checked by an upper cervical chiropractor. These doctors focus solely on the upper neck. We run testing to find out if you have a misalignment. And once we know if you have a misalignment, we take 3D imaging, which allows us to know exactly how the vertebrae travel out of position, so we know how to precisely correct your pattern that's unique to you. If this sounds like you, leave a comment in the comment section below, and we can find you an upper cervical chiropractor in your area.